Hello, and welcome to another episode of Med Concept Contrasts, the show where we break down complex medical topics into understandable, real world conversations. I'm your host, Dr. Anby, and today we're diving deep into a critical area of cardiovascular medicine: coronary artery bypass grafting versus percutaneous coronary intervention. But today isn't just about the science. We're going to make this discussion interesting by weaving in real world examples and patient stories while exploring the heart of what makes these decisions so impactful: people's lives, their health, and the sometimes difficult choices they face. So grab a cup of coffee or settle into your commute. Over the next 30 minutes, we'll explore the how and the why behind these life changing procedures. Let's begin by setting the scene with a common situation in cardiology: a patient with crescendo angina pectoris, severe multivessel coronary artery disease involving the proximal left anterior descending (LAD) artery, and left ventricular systolic dysfunction. This is the kind of patient who has already been through a lot. They've likely had several trips to the emergency department due to worsening chest pain, their quality of life is diminishing, and the threat of a heart attack looms large. Today's episode will address the clinical decision making between coronary artery bypass grafting and PCI and delve into the human side of these interventions, how we make these choices, and the profound impact they have on patients' lives. To make this discussion more tangible, let's imagine we're talking about Mr. John Thompson, a 63-year-old man who has always been active. He loves gardening, walking his dog, and spending time with his grandchildren. However, over the past few months, John has been experiencing worsening chest pain. His angina has become more frequent and severe, what we call crescendo angina. He can't walk to his mailbox anymore without feeling like a weight is on his chest. It's not just affecting his physical health, he's becoming increasingly anxious and frustrated. After several visits to his primary care physician and some inconclusive tests, John is referred to a cardiologist. An angiogram reveals severe multivessel coronary artery disease with significant involvement of the proximal LAD artery. To make matters more concerning, he's also diagnosed with left ventricular systolic dysfunction, meaning his heart's ability to pump blood has weakened. His cardiologist sits him down to explain the findings. John listens intently as the doctor explains that his condition puts him at high risk for a heart attack, and that lifestyle changes and medications alone aren't enough to manage his condition anymore. Now he's faced with a significant decision. Should he undergo coronary artery bypass grafting surgery or PCI? Before we dive into the treatment options, let's take a moment to understand what's happening inside John's body. Coronary artery disease, or CAD, occurs when the arteries that supply blood to the heart muscle become narrowed or blocked by atherosclerosis. This is a buildup of cholesterol, fat, calcium, and other substances, collectively known as plaque, on the artery walls. Over time, these plaques can harden and narrow the arteries, limiting the flow of oxygen rich blood to the heart. The left anterior descending (LAD) artery is particularly crucial because it supplies a large portion of the heart muscle, especially the front wall of the left ventricle, the heart's main pumping chamber. Significant blockage in the LAD is often referred to as the widowmaker because it can lead to massive heart attacks. In John's case, the stakes are high. His angina is a warning sign that his heart isn't getting enough blood. Coupled with left ventricular systolic dysfunction, his heart isn't pumping as efficiently as it should. Both conditions significantly increase his risk of a severe cardiac event if not appropriately treated. When treating patients like John, who has complex coronary artery disease, the goals of treatment are clear and focused on three key outcomes. First and foremost, the aim is to improve symptoms, mainly by alleviating John's chest pain and helping him regain a better quality of life. For someone who has been limited by his condition, restoring a sense of normalcy in daily activities is a priority. The second goal is to reduce cardiovascular morbidity, which means lowering the risk of severe complications like heart attacks, heart failure, or other related issues. By addressing the root causes of John's coronary artery disease and preventing further deterioration, his doctors hope to significantly reduce his chances of experiencing these life-threatening events. Finally, the overarching objective is to improve overall survival. In John's case, this means extending his life expectancy by lowering the risk of sudden cardiac death or other severe cardiac events. With the right treatment plan, The goal is to not only add years to John's life, but also to ensure those years are lived with better health and fewer concerns about his heart. Achieving these goals requires a comprehensive approach. First, aggressive lifestyle modifications are essential. For John, this involves making significant changes like quitting smoking, adopting a heart healthy diet rich in fruits, vegetables, whole grains, and lean proteins, and incorporating appropriate physical activity into his routine. Managing stress is another critical factor, as it can significantly impact heart health, and practices like meditation, yoga, or counseling may be beneficial. In addition to lifestyle changes, optimal medical therapy plays a vital role in managing John's condition. This includes medications like aspirin to prevent blood clots, beta blockers, and ACE inhibitors to lower blood pressure and reduce the workload on the heart, statins to control cholesterol levels, and nitrates to manage chest pain. These medications work together to address the symptoms and risk factors of coronary artery disease, helping to stabilize John's condition. Finally, coronary revascularization, whether through coronary artery bypass grafting or PCI, is a critical intervention to restore adequate blood flow to John's heart. Given the complexity of his disease, coronary artery bypass grafting offers the best long-term benefits. By bypassing the blocked arteries, the aim is that John's heart receives the oxygen and nutrients it needs to function correctly, reducing his symptoms and improving his chances of avoiding further heart complications. This comprehensive approach, combining lifestyle modifications, medical therapy, and revascularization, gives John the best possible chance of achieving these goals and living a longer, healthier life. Let's start by explaining coronary artery bypass grafting. Imagine John's heart as a city with blocked highways causing massive traffic jams. The neighborhood's heart muscle aren't receiving essential supplies, oxygen, and nutrients because the delivery trucks' blood are stuck. Coronary artery bypass. Grafting is like constructing new roads to bypass these traffic jams, ensuring supplies reach their destinations. In the surgical procedure, a cardiac surgeon takes a healthy blood vessel from another part of John's body, often the saphenous vein from the leg or the internal mammary artery from the chest, and grafts it onto the blocked coronary artery. This creates a new pathway for blood to flow around the blockage. John's cardiologist then goes over the critical aspects of coronary artery bypass grafting, emphasizing that while it is a significant surgery, it is also highly effective for patients with complex conditions like John's. The procedure involves using general anesthesia and requires opening the chest cavity to access the heart. In many cases, surgeons use a heart-lung machine to keep blood circulating. At the same time, the heart is temporarily stopped, allowing them to create bypasses around the blocked arteries using healthy blood vessels from elsewhere in the body, such as the leg or chest. Despite its invasive nature, coronary artery bypass grafting has long-term benefits, particularly for patients like John, who have left ventricular systolic dysfunction and severe multivessel disease, especially involving the LAD artery. Studies have repeatedly shown that coronary artery bypass grafting offers better long-term survival rates than PCI in similar patients. This is mainly due to its ability to provide more complete revascularization, bypassing not just one but several arteries if needed, restoring blood flow to large portions of the heart muscle. Another critical advantage of coronary artery bypass grafting is the reduced need for repeat procedures. While PCI patients may face the risk of restenosis, where the arteries re-narrow after treatment, coronary artery bypass grafting offers a more durable solution. Once the grafts are in place, they tend to remain open longer, decreasing the likelihood of John needing additional interventions. This is essential for someone who wants to avoid repeat hospital visits and future surgeries. The cardiologist also shares clinical evidence from notable studies, like the Syntax trial, which highlights the advantages of coronary artery bypass grafting in patients like John. The Syntax trial and other similar research have demonstrated that for patients with diabetes and multivessel coronary artery disease, coronary artery bypass grafting results in lower rates of all-cause mortality and fewer myocardial infarctions, heart attacks, compared to those treated with PCI, even when using modern drug-eluting stents. This evidence supports coronary artery bypass grafting as the best option for long-term outcomes in complex cases like John's. Although the surgery involves a longer recovery and carries some immediate risks, the benefits of better survival rates, reduced chances of future heart attacks, and fewer repeat procedures make coronary artery bypass grafting a compelling option for John as he weighs his choices. Now let's step away from the medical jargon and consider John's emotional journey. John is sitting in his cardiologist's office, overwhelmed by the news. The thought of undergoing open heart surgery is terrifying. He's worried about the risks, the pain, the recovery time, and how it will affect his family. He remembers his neighbor, Mrs. Linda Garcia, who had coronary artery bypass grafting surgery 2 years ago. She told him about the challenging recovery, the discomfort, the limitations on physical activity, and the emotional toll. But she also shared how much better she feels now. She can play with her grandchildren again and no longer lives in fear of a heart attack. John weighs these stories heavily. He thinks about missing his granddaughter's soccer games, the garden he loves tending to, and the possibility of not being around for future family milestones. Seeking less invasive alternatives, John asks his cardiologist about percutaneous coronary intervention, commonly called PCI or angioplasty with stent placement. The cardiologist explains that PCI involves threading a thin catheter through an artery in the wrist or groin and guiding it up to the blocked coronary artery. Once in place, a small balloon is inflated to widen the artery, and a stent is inserted to keep it open, allowing blood to flow more freely. The benefits of PCI are immediately apparent. It is a minimally invasive procedure, meaning there is no need for open heart surgery or general anesthesia. The process typically takes about an hour, and most patients go home the next day. For John, this would mean a much quicker recovery compared to coronary artery bypass grafting. He could be back on his feet and return to his daily activities far sooner, with less discomfort and a lower risk of postoperative complications. PCI is especially effective for patients with single vessel disease or less complex blockages where one or two arteries are affected. Still, the overall condition is not as severe as John's. However, in John's case, the cardiologist is cautious about PCI being the best option. John's condition involves multivessel coronary artery disease affecting the proximal LAD, and he also has left ventricular dysfunction, both of which make PCI less effective. The nature of his disease is more complex, meaning PCI might not fully address all the blockages, leaving some untreated or inadequately managed. Additionally, there's a higher risk of restenosis, where the arteries may become blocked again after the procedure. This could lead to the recurrence of his symptoms and the need for additional procedures down the road, which is a significant concern given the severity of his condition. While PCI offers a less invasive route with a faster recovery, John now understands that its long-term effectiveness may be compromised in his case. The thought of needing repeat procedures in the future makes him hesitant, especially when weighed against the more durable benefits of coronary artery bypass grafting. Despite the appeal of PCI's minimal invasiveness, John realizes that his specific condition may require a more comprehensive solution, and this insight plays a crucial role in helping him move closer to a decision. Studies have shown that in patients with complex CAD, especially involving the LAD, PCI is associated with higher rates of repeat revascularization and doesn't improve long-term survival as effectively as coronary artery bypass grafting. John's cardiologist takes the time to thoroughly explain both treatment options, outlining the pros and cons of each, helping John navigate this critical decision. First, the cardiologist begins with coronary artery bypass grafting. On the positive side, coronary artery bypass grafting offers better long-term survival, especially for patients with complex coronary artery disease like John's. It also significantly reduces the risk of future heart attacks and lowers the likelihood that John would need any additional procedures down the road. However, there are notable drawbacks. Coronary artery bypass. Grafting is a major surgery that comes with inherent risks, such as infection, stroke, or complications from anesthesia. John would need to stay in the hospital for a more extended period, often up to a week, and his recovery time would extend for several months, during which he would need physical therapy and plenty of rest. It's a challenging road, but the proper support can lead to a healthier future. On the other hand, the cardiologist explains the benefits of PCI. which offers a less invasive alternative. John would experience a shorter hospital stay, typically just 1 or 2 days, and could return to normal activities much more quickly. There's no need for a large incision or heart lung machine, and the overall recovery is much easier. However, for someone like John, who has multivessel disease and left ventricular dysfunction, PCI might not be the ideal solution. There's a higher chance of needing repeat procedures, as PCI can be less effective in patients with complex conditions. It's possible that the arteries could become blocked again, necessitating additional interventions. As the cardiologist lays out these options, John finds himself torn. The idea of undergoing major surgery is daunting. He's apprehensive about the recovery time and the possible complications, which weigh heavily on his mind. At the same time, the possibility of a better long term outcome with coronary artery bypass grafting is compelling. Knowing that coronary artery bypass grafting could reduce his heart attack risk and provide a more durable solution for his condition gives him hope. The decision feels overwhelming, and John realizes that whatever choice he makes will significantly impact his future health and quality of life. Ultimately, John needs to reflect on what's most important: the immediate ease of PCI or the potential for a longer, healthier life with coronary artery bypass grafting. With his cardiologist's guidance and the support of his family, John knows that while the path ahead is challenging, he has the information he needs to make the best possible decision for his future. John decides that the gravity of his condition warrants a family discussion, so he gathers with his wife Mary and their 2 adult children, David and Emily, around the dining table. It's not an easy conversation, but John knows having their support and input is essential. Mary naturally is worried about her husband. She's seen him struggling with chest pain for months, and while she's anxious about the risk of surgery more than anything, she wants John to choose the option that will give him the best chance for a long, healthy life. "I just want you to get better," she says, her voice filled with concern. "We need to do whatever gives you the best chance of returning to yourself." David, the family's data-driven thinker, approaches the decision differently. As an engineer, he wants to know all the facts, the statistics, and the data points. He asks John's cardiologist for detailed information, wanting to understand how coronary artery bypass grafting compares to PCI regarding outcomes, risks, and success rates. "What do the numbers say?" he asks, leaning in. "How does the success of coronary artery bypass grafting hold up over time? What are the chances you'll need another procedure if you use PCI instead?" As a nurse, Emily is more familiar with the medical side of things. She's already leaning towards coronary artery bypass grafting, understanding that for someone like her dad, with multivessel coronary artery disease and left ventricular dysfunction, it offers the best long term prognosis. "Dad, I know surgery is scary," she says gently, "but given your condition, coronary artery bypass grafting does seem like the best option for your future." As they talk, several key points come to the surface. First and foremost is John's quality of life. He tells them how much he misses being active, how even simple tasks like walking the dog or gardening have become overwhelming with the constant chest pain. "I just want to feel normal again," John says. "I don't want to live in fear every time I feel a twinge in my chest." The family agrees that whatever choice is made, it has to give John the best chance to regain his quality of life without the looming threat of a heart attack hanging over him. They also discuss the risks versus benefits of both options. While coronary artery bypass grafting is a major surgery with a more extended recovery period, the long term benefits, particularly the reduced risk of another heart attack and fewer chances of needing additional procedures, are compelling. PCI, while less invasive, might not provide the same lasting results in someone with complex coronary disease like John. They carefully weigh the immediate risks of surgery against the potential for a healthier future without repeat interventions. Finally, there's the emotional impact to consider. Living with severe coronary artery disease has been incredibly stressful for John. The fear of his condition worsening or having a heart attack weighs heavily on him every day. At the same time, the idea of undergoing open heart surgery isn't something he takes lightly. The family acknowledges the emotional toll on everyone, whether it's the stress of his current situation or the anxiety of going through surgery and recovery. Emily points out that while surgery is a big hurdle, once he's on the other side of it, his anxiety about his heart health may diminish. "The surgery might be tough, Dad, but afterward, you'll be able to live without constantly worrying about what your heart is going to do next," By the end of their conversation, John feels more at peace. He knows it's a difficult decision, but with his family's support and understanding, he can approach it more clearly. Together, they have weighed the medical facts, the emotional considerations, and most importantly, John's personal goals for his life moving forward. John's cardiologist shares the story of Mr. Robert Miller, a patient with a similar condition who opted for coronary artery bypass grafting. Robert was 60 when he underwent coronary artery bypass grafting. He was an avid cyclist but had to stop due to his worsening angina. Post surgery, the recovery was tough. There were days he questioned his decision. But a year later, he was back on his bike, participating in charity rides, and feeling better than in years. Hearing Robert's story gives John hope. It helps him visualize a life beyond the surgery, a life where he can return to the activities he loves without constant fear. Regardless of the revascularization method chosen, optimal medical therapy and lifestyle modifications are essential. Medical therapy for coronary artery disease includes several vital components. Antiplatelet agents, such as low dose aspirin, prevent blood clots from forming, reducing the risk of heart attacks. Beta blockers help by reducing the workload on the heart and controlling blood pressure. Statins are essential for lowering cholesterol levels, preventing further plaque buildup in the arteries. Additionally, ACE inhibitors are prescribed to help manage blood pressure and protect heart function over the long term. Alongside medical therapy, lifestyle modifications are equally important. Smoking cessation is crucial, as it eliminates one of the significant risk factors for the progression of coronary artery disease. A heart healthy diet, rich in fruits, vegetables, whole grains, and lean proteins, helps manage cholesterol and overall heart health. Physical activity tailored to the patient's condition strengthens the heart and improves cardiovascular fitness. Finally, stress management techniques such as meditation, yoga, or counseling can reduce the emotional and psychological stress accompanying chronic heart conditions, contributing to overall well being. John realizes that surgery or PCI isn't a cure all. He needs to commit to these changes to ensure the best possible outcome. John asks about other medications he's heard of, like ranolazine, and whether they could be alternatives. Ranolazine is an anti-anginal medication that can help reduce symptoms, but doesn't improve long-term survival or address the underlying blockages. It's typically used when other drugs aren't effective. Similarly, adding medications like amlodipine or niacin can help manage symptoms or certain risk factors, but won't resolve severe blockages or improve survival in cases like John's. John's cardiologist also explains that medicine is constantly evolving, with new approaches being developed to enhance treatment options for coronary artery disease. One such advancement is hybrid revascularization, employing a combination of coronary artery bypass grafting and PCI. For instance, coronary artery bypass grafting might be performed on the left anterior descending LAD artery, while PCI addresses other blockages in the coronary arteries. This approach allows for tailored treatment that maximizes the benefits of both procedures. Additionally, the cardiologist highlights the progress in minimally invasive coronary artery bypass grafting techniques. These newer surgical methods involve smaller incisions and less recovery time than traditional open heart surgery. However, they may not be suitable for all patients depending on the complexity of their condition. However, in John's case, traditional coronary artery bypass grafting remains the gold standard due to the complexity of his disease. After discussing with his family and considering all the information, John decides to proceed with coronary artery bypass grafting. He feels that the potential for a longer, healthier life outweighs the challenges of surgery and recovery. He wants to be there for his family, see his grandchildren grow up, and return to his hobbies without the constant fear of chest pain or a heart attack. John undergoes coronary artery bypass grafting surgery, which takes approximately 4 hours to complete. During the procedure, surgeons use his internal mammary artery, along with a vein from his leg, to bypass the blocked arteries in his heart. Fortunately, the surgery is a success, with no complications arising. John spends a week in the hospital, including time in the intensive care unit, to ensure his recovery starts smoothly. His physical therapy begins gradually, with short walks and breathing exercises designed to help him regain strength slowly and safely. Emotional support plays a crucial role in his recovery as well, with his family by his side and regular counseling sessions to help him cope with the emotional challenges of the process. Over the next few months, John diligently follows the advice of his medical team, attending cardiac rehabilitation and making the necessary lifestyle changes. He gradually regains his strength and stamina. By 6 months post surgery, John has resumed many of his regular activities. He can walk his dog, tend to his garden, and even start swimming again, something he hadn't done in years due to his heart condition. His emotional well being improved significantly as well. John feels more optimistic and less anxious, no longer living in constant fear of a heart attack. He cherishes the time spent with his family and deeply appreciates their support throughout his recovery. John continues to take his prescribed medications, attend regular follow up appointments, and maintain the healthy lifestyle he adopted after surgery, ensuring that his heart remains as healthy as possible moving forward. To summarize the key points from John's case and how it relates to managing complex coronary artery disease, let's break it down into a few essential concepts that highlight the preferred approaches and outcomes. In patients like John who have diabetes, multivessel coronary artery disease involving the proximal LAD, and left ventricular dysfunction, coronary artery bypass grafting stands out as the preferred revascularization strategy. This is because it offers better outcomes over the long term. Coronary artery bypass grafting has been shown to reduce mortality rates, lower the risk of heart attacks, and significantly decrease the likelihood of needing repeat procedures. For patients with complex heart disease like John's, coronary artery bypass grafting provides a more durable solution than PCI. While PCI is less invasive and might seem attractive due to its shorter recovery time, it's generally less effective in cases like John's. PCI doesn't offer the same long-term benefits for patients with severe multivessel disease. The risk of the arteries becoming blocked again is higher, and it often leads to the need for additional interventions down the road. For patients with more straightforward or single vessel disease, PCI can be a great option, but in complex cases involving multiple blockages, coronary artery bypass grafting is often the better choice. That said, comprehensive care is essential no matter which procedure a patient undergoes. Whether John had chosen coronary artery bypass grafting or PCI, both would need to be accompanied by lifestyle modifications and optimal medical therapy. This includes making critical changes to diet, exercise, smoking cessation, and taking medications to manage cholesterol, blood pressure, and diabetes. Surgery or PCI is just one piece of the puzzle. Long-term health depends on these lifestyle changes and consistent medical management to control risk factors. And finally, one of the most critical elements in John's case was the patient-centered decision-making process. It was crucial to involve John and his family in deciding on his care. By discussing the options and weighing the risks and benefits together, John's cardiologist ensured that the chosen treatment reflected the best medical advice and John's personal values, preferences, and what was important to him and his loved ones. This collaborative approach ensures that the care plan is tailored to the individual and their unique circumstances, leading to better outcomes and greater satisfaction. In the end, John's case highlights how a holistic and personalized approach to treating complex heart disease can lead to better long-term health, where medical interventions are combined with lifestyle changes and the patient's goals to create a plan that truly works for them. Thank you for joining us on this journey through the complex decision-making process between coronary artery bypass grafting and PCI. We've seen how medical facts intertwine with personal values, fears, and hopes. John's story illustrates the importance of individualized care and the profound impact these decisions have on patients' lives. Remember, every patient's situation is unique. The best choice depends on a combination of medical evidence and personal considerations. Suppose you or a loved one is facing a similar decision. In that case, I encourage you to have open conversations with your healthcare providers, ask questions, and consider all medical and personal aspects.